so that I am the person standing between your lunch and your concentration. But I just want to request you for less than 10 minutes, and I'll be done to basically share with you how we intend to continue our engagement and partnership with some of you. So I'll be sharing with you part of what I already spoke about yesterday, which is basically looking at our engagements in enhancing citizen participation in effective health governance. And so what this basically means is through a tool which is called the County Governance Index, which assesses performance of counties on health, education, agriculture, water, and infrastructure. So our project engagement is based on a number of issues, and some of those issues border on the fact that citizen engagement in our evolved governance system over time has not been quite effective. It's not been quite progressive. Of course, we are making very good strides, but there are certain gaps that still need to be strengthened. So because of time, I will not really dwell on what is on the screen, but I'll just use it to give you guidelines and pointers on what we need to do. That as part of what we seek to do is to strengthen aspects of dialogues between the government officials and the citizens. The strength that county governance work is bringing on the table is, for example, experience in policy development. I will not go into the details of sharing with you some of the good policies that we have worked with other counties to be able to assist them. But yesterday I spoke about Nairobi City County, for instance, where we have been able to help the county government to do the county youth policy, which was launched by Governor Anne Kananu, and also the Prevention of Violent Extremism Act, through which actually, as I mentioned, the county was quite instrumental. The county assembly appropriated about 75 million to be able to ensure that those programs are taking place. The other bit of it is technical support to county assembly through its committees on those areas: health, education, agriculture, water, and infrastructure. So the committee of the assembly that deals with health is going to be one of our very good friends, because we believe that in exercising their representation role, the voices of the citizens therefore need to be enhanced. So the three things that we'll be looking at is one, of course, strengthening partnerships. Some of you have come to me asking, can we be able to get mechanisms or opportunities to also get resources to support our work? And for the three that I have talked to, we are going to agree to be able to, one, do a mapping of stakeholders. If it is Pumwani, who are the other stakeholders that are engaging on health within Pumwani Health Facility? What aspects of health are they engaging in? And how much value is that adding to the health facility? What is the engagement of the citizens in whatever it is that they are focusing on? So basically looking at strengthening partnerships between state and non-state actors and the citizens. The second bit of it is empowering citizens to be able to deal with the dismal failures, especially on the quality of healthcare. If you talk to citizens, they will tell you that they have issues. And some of those issues, in fact, from the index that we have done, is attitude of healthcare providers. Mutu tu hataki kukuongelesha. So is it me who made you have a very bad morning as you walk to the health facility? You know? So right from the gate, how do you make the facility customer friendly? And I think Mheshimiwa Waziri yesterday spoke about customer care as being the bottom, the second thing that she wants to address. How do we therefore deal with issues of lack of drugs? You know, whose responsibility is it to ensure that there are available drugs within the facility? And even if there are no drugs, how do we communicate it to the citizens? So do we have, for example, feedback boxes in our health facilities? Do we have feedback mechanisms? Whose responsibility is it to communicate to the citizens about some of these failures that we are calling dismal failures in the quality of health service delivery. The third thing is, of course, the public expenditure management, focusing on on-source revenue. How can we be able to take advantage of what we currently have to enhance OSR? Do the board members understand the streams of on-source revenue for our health facility? What is the capacity of OSR in the various facilities that we come from? And then ultimately, how does that add to the general wider budget of the county government? And so I'm happy that KSG has been taking us through the public finance management issues, and I'm hoping that we'll also be able to have a session on OSR so that we understand what it is, because the citizens, from whom part of you and some of you here, like with these with whom we have worked and others, already understand the streams. There are over 110 streams for counties to generate OSR, what those streams mean, and their capacity has already been built to be able to engage with the health facilities and to ask the right questions. So what therefore does that mean to us as board members and etc.? So what are some of the expected outcomes for effective health governance in the three areas that we want to engage with? One, we are looking forward to seeing an enhanced citizen oversight. And I'm happy because the governor picked, I think, one of the things that we recommended earlier on, and we were saying that for effective health care to be responsive to citizens, it would be important that we have mechanisms of engagement. So that down here, if we have citizens, then we have health management committees. And then over time, we have the health management boards, who I believe you are the ones. What is the engagement between service provision and oversight? Are there mechanisms where we see the citizens engaging directly with the health management teams at the facilities? And how therefore do the boards provide avenues for feedback both to the HMTs and then to the citizens? So as I'll be finishing my presentation, we have a few areas where we believe that we can be able to support, beginning even tomorrow, on certain facilities where, from our analysis, we believe that there is a lot of capacity that needs to be put. Not capacity for equipment, but capacity in terms of the soft mechanisms, things that we believe that can cover for major gaps and major areas. The second bit of it, of course, is strengthening the networks, or rather strengthen networks and institutions for capacities to improve on coordination and engagement between the county government and the citizens. But we're also happy because most of you here are board members who are not county officials. Of course, that is what is expected, and it's also much more closer because we are having the induction session with almost everyone who engages at the facility. The third thing is increased citizen engagement with county officials. And so at the end of it, for example, we have proposed a governance roundtable for healthcare providers. And even before the governance roundtable, we want to have opportunities for MedSoups, the medical practitioners, the healthcare management teams speaking to the citizens that they serve. How do you get responses on challenges that people have, even insofar as the service that you are offering? Do you have customer satisfaction surveys, for example, even within the health facility? Do you have responses for instance, the healthcare service charters? Do our facilities even have service charters? And do we clearly understand the feedback that citizens have in terms of what services we are offering? Do people even know the services that we offer in those facilities? Then the last one is knowledge and skills. And this is across the board, both for the citizens and also for the healthcare workers in terms of capacity building, technical assistance, and inbuilt research mechanisms. And I remember a conversation that we had initially with Dr. Esam when he was at NMS. I think that was many years ago when we started engaging with the county government about digitization. So that not just for healthcare workers, but even citizens, is there a portal that they can just log in and even check if I want to go and seek for a certain service in a given facility from the comfort of my home? can I just log in and check how many people are left, other than going and wasting time, a whole 8 hours waiting with the queue for you to be attended to. And Nairobi County, I believe, has that kind of capacity. I won't go into this, just highlighting some of the things that we have done, but our current project is engaging around Langata, Kasarani, Embakasi East, Dagoretti, Starehe, Westlands, and Kasarani areas. So if you are a member here, I think it's important for us to have a conversation, including with the management leadership, because we want to come and have conversations with you around what are your needs. So more or less like a needs assessment. And therefore, how can we be able to strengthen the partnership to see how it works? We've had very good conversations, public participation meetings. We've had engagements with the county assembly teams. This is Mheshimiwa Wadera Chege, of course, public participation issues, and those are some of those processes. Same, so that's a part of the County Governance Index. We have done analysis for Nairobi County budget since 2015. And now we are doing the latest, I think, is 2021, 2022, and just focusing on those 5 key service delivery areas.